Good evening, everyone. Wynn Brown here with our evening update for COVID-19 for Haywood Healthcare on April 7th, Tuesday, April 7th. Let me just go right to the numbers and give you an update where we are in our region. We have 874 patients tested overall with 645 negative results, 142 considered positive with virus detected, and 5 that were indeterminate. Our positive rate in our region is 15.9% versus the state region, which has risen to 18.1%. So I think we're starting to see a little bit of an uptick here in the positive rate, obviously. And if you look at the projections, we're supposed to start increasing right about now. We have 8 positive COVID patients in the hospital right now, 5 of whom are in our ICU. We have 3 patients under investigation, meaning, 9 patients under investigation awaiting their test results back. Just a reminder to those of you in the community, our community providers and physicians, that if you're doing COVID testing, please submit those to Haywood Hospital versus dropping them off at the urgent care. We're really working with the state to make sure that they can monitor testing locations to see where the testing is taking place in the reporting out. Also, a shout out to Cushing Academy today. I mentioned that they had some masks coming. They donated 2,300 surgical masks today that were sent to them by their families who live abroad, and that is fantastic. And Athol High School is firing up their 5 3D printers to make face shields for our staff as well, and that is fantastic. And face shields are heavily used throughout the health system these days, so thank you for that. Ironically, today is World Health Day for the World Health Organization to celebrate healthcare workers, and especially as we look at our nurses and frontline providers as well. It's a great time for us to look across the globe and locally and thank our providers. So thank you, all of you, on World Health Day in the midst of this pandemic. On a fun note, we have our fleece orders coming in from John's Sports Shop for Haywood Hospital, and Ann Brewer from our Volunteer Services Department will be delivering those to the specific units for folks who ordered staff through payroll deduction, and those will be coming in. And then just thanks and another shout out to our EVS staff. One of them created a great spirited bulletin board recognizing the great service that they provide. And so it's great to see that attitude and commitment amongst those folks that are making sure that we have a safe environment to practice that is clean and disinfected. And it is yeoman's work, and a thumbs up to our EVS team as well. Also online and embedded with this video is a link to get some Haywood Strong apparel that has been developed. Athol Strong will be coming out shortly as well. So you can hop on there even before it went live publicly. There's been a lot of orders, and you can do that through payroll deduction as well. So a solid inpatient day on the Haywood campus, not as busy across the rest of the system as you would imagine and would expect. And we have been doing a lot of work looking at how we're going to adjust our staffing going forward to meet the lower demand in many parts of our system. And so we worked on that today, and by the end of the day tomorrow, early Thursday morning, we'll come back with a more robust report of how we're going to adjust to our new normal, given the volume across the health system. I know there's been a lot of chatter out there wondering what we're going to be doing, and we want to make sure that we're thoughtful and complete about that. And so we're going to be working on that, finishing that up tomorrow, and sharing that across the system at that point in time to make sure that we've got everything together. So until then, I appreciate the great work everybody did today. For those of you who are working tonight, thank you very much for taking care of our patients who really need our support and care at this point in time. And I'll be back to you tomorrow with a little update on the evening and what you can expect for the day ahead. And until then, thank you everyone as we continue our journey to be one of the best community-owned health systems in America. Good night.